Good evening. We have already covered anatomy and physiology. Now we are going to the short course of pathology. Now let's try to understand pathology. It is the study of the diseased organs, and also it covers the various microorganisms and pathogenic organisms. The pathos means the suffering and logy means study. Hence the pathology term has been coined. Dr. Rudolf Virchow is also known as the father of modern pathology. Why? Because he has studied the diseased cellular organism in plants. He was the person who has proposed that the cell divides into two and gives rise to new generation cells. Further, we are going to study in detail about the vital organs and few of the diseases which affects the vital organs. Now let's go through. Brain. Few diseases of the brain, that is hemiplegia, meningitis and Parkinsonism. Hemiplegia. It occurs due to ischemia of the brain. Whenever there is a lack of blood supply or there is a bleeding in the brain parenchyma, it results into the loss of sensations and the locomotor function of the hands or legs, resulting into the paralysis of the patient. Meningitis is the infection and the inflammation of the membranes of the brain. It occurs due to bacterial infection or else viral infection. The patient usually suffers with or comes with high-grade fever, projectile vomiting and neck stiffness. The patient may also the patient be brought unconscious. Parkinson's disease. Parkinson's disease is due to lack of dopamine or decreased secretion of dopamine in the brain parenchyma. The patient complains or comes with rigidity, tremors, speech difficulties and slow movement. Now we move on to the next vital organ, that is circulatory system or cardiovascular system. We will be covering the most vital disease, that is atherosclerosis. Atherosclerosis is a plaque formation or the calcification of the inner vessels of the artery. Due to the plaque formation, there is narrowing of the blood vessel and the oxygen supply to the tissue is hampered. Because of this, the tissue undergoes death or necrosis. If there is narrowing of the coronary vessels, there is less of oxygen supply to the cardiac muscles of the heart and there is ischemia or infarction of the cardiac muscles. This is also known as heart attack in layman's language. The patient complains with precordial chest pain, sweating and restlessness. If we observe this following symptoms in the patient, we need to rush to hospital immediately. We move on to the next vital organ, that is lungs. We will be covering two diseases, that is bronchial asthma and pneumonia. Bronchial asthma normally is an allergic condition. It is a disease where the patient who is sensitive to the allergens normally experiences lack of breathlessness. When the person is exposed to the allergen, the mast cells releases bradykinin and histamine. This forms a mucus plug around the alveoli and decreases the passage of oxygen, and there is less of oxygen exchange and results in difficulty in breathing. The another topic is pneumonia. Pneumonia is an infection which occurs due to viruses or bacteria. This happens in the parenchyma of the lungs, whereby there is fluid accumulation or pus accumulation in the alveoli, resulting in breathlessness. Next, we move on to the most vital organ of the body, that is liver. The disease which is very fatal in liver is known as cirrhosis. Cirrhosis is the death of the parenchyma or the hepatic cells. It occurs due to hepatitis B virus or as chronic alcoholism. The next diseases which we will be covering is of excretory system. The kidney diseases like kidney stones and chronic pyelonephritis. The kidney stones occurs due to the crystallization of calcium or is oxalate crystals. This occurs in the calyces or the pelvis of the kidney parenchyma, or it can run through the ureters or the urinary bladder. The patient usually complains of pain in the lumbar region and going to the groin region. They experience colicky type of pain. There is associated bleeding in the urine sometimes. Next we move on to the chronic pyelonephritis. Chronic pyelonephritis is the infection of the kidney parenchyma. Over here, there is inflammation of the kidney parenchyma. Atony of the kidney is the infection of the kidney parenchyma. Over here, there is inflammation, atrophy and scarring. This usually occurs due to the infection in the urinary bladder which runs up to the kidney. If these kidney diseases are untreated or left untreated, then it results in chronic renal failure. Next we move on to prostate, which is this organ is normally present in the male reproductive system. We often find there is an enlargement of the prostate. The patient usually comes with a complaint of nocturnal enuresis, and there will be obstruction during flow of urine. We need to be cautious and do a repeated examination so that we can rule out malignancy on time. Now we move on to next diseases which are caused due to parasites, plasmodia and viruses. The most fatal disease or the most notorious disease is malaria. Malaria is caused due to the plasmodium and it is spread via the female Anopheles mosquito. There are three types of malaria, that is Plasmodium ovale, Plasmodium vivax and Plasmodium falciparum. Plasmodium falciparum is the fatalist disease of malaria and it is also known as cerebral malaria. The patient usually complains of fever with chills. We move on to amoebiasis. Amoebiasis is a protozoal disease and is caused due to ingestion of the infected food. The patient complains with colicky pain and diarrhea with mucus. Amoebiasis is left untreated, it results in amoebic liver abscess. Next, we will be covering in viruses two topics, that is hepatitis B virus and herpes virus. Hepatitis B virus is usually spread via blood transfusion or else using infected injections or syringes. Hepatitis B virus is usually untreatable, hence we need to be very cautious while blood transfusions or giving injections. Herpes virus are of two types. One is herpes zoster and herpes simplex. Both the viruses usually occur in an immunocompromised patient. If not treated on time, it will result in fatal consequences. We move on to locomotor system. We will be covering few diseases of the locomotor system such as osteoarthritis, spondylitis and gout. Osteoarthritis are of two types, rheumatoid arthritis and the degenerative osteoarthritis. Rheumatoid arthritis is an autoimmune disorder. Degenerative osteoarthritis occurs due to loss of synovial fluid and it occurs during the aging process. The patient usually complains of pain and difficulty in movement. Rheumatoid arthritis along with these following symptoms is associated with morning stiffness. Spondylitis. Spondylitis occurs due to inflammation of the tissues around the spinal cord. The patient complains with the muscular spasms and pain around the region. If this remains untreated and there is a compression, then it may lead into monoplasia, paraplegia or quadriplegia. It is also known as pinched nerve. Patient also complains of tingling and numbness where there is a compression observed. Now we move on to gout. Gout is also known as the rich man's disease. It happens due to the accumulation of the uric crystals in the joints, and the normal site is on the greater toe. It is also known as tophi when it occurs on the greater toe. These diseases are usually diagnosed on blood investigations, urine investigations, sputum investigations, and fluid investigations. Fluid investigations are like cerebrospinal fluid, synovial fluid, and pleural fluid. Thank you.